Okay, maybe I will start now. It seems like the distributor already joined. Oke. Baik, selamat pagi Bapak dan Ibu selaku representatif atau perwakilan dari berbagai rumah sakit, klinik, maupun PT untuk alat kesehatan. Perkenalkan, saya Corina dari MedMap yang bertugas sebagai host maupun moderator dalam virtual event pada hari ini. Sebelumnya, saya ingin berterima kasih atas partisipasi Bapak maupun Ibu untuk dapat hadir di webinar on Women's Health Screening and Diagnosis by MedMap and Turing Medical as a speaker. Mungkin pada kesempatan kali ini, MedMap bekerja sama dengan Turing Medical akan membawakan sebuah solusi klinikal dan produk untuk screening health and diagnosis, terlebih pada wanita. Secara singkat, MedMap sendiri setiap bulannya akan terus membuat virtual event seperti ini sebagai wadah untuk mempertemukan distributor, medical enthusiast, dan para anggota dari rumah sakit maupun klinik untuk dapat bertemu langsung dengan manufaktur alat kesehatan dari berbagai negara. Baik, tentunya kami akan membawakan event ini dengan tema yang berbeda setiap bulannya, sehingga pada hari ini, mungkin sebelum saya memperkenalkan lebih jauh MedMap dan Turing Medical, kita akan mendengarkan remix atau pembukaan dari representatif MedMap untuk membuka acara pada hari ini. Untuk waktu dan tempat, mungkin Regina, saya persilahkan.
Oke, halo semua, bisa dengar suara saya?
Iya, bisa.
Oke, baik. Hello everyone, good morning. I would like to thank you to all the attendants today to our first event and collaboration with Turing Medical. So let me give a brief explanation about who are we first. So MedMap is a consolidation platform who wants to bridging the medical manufacturer and regional distributor to get engaged, to get more collaboration and networking, to provide the excellent medical products and service to the healthcare organization in the Southeast Asia, especially in Indonesia. In this event, we have Turing Medical as our speaker, who will give us the explanation about their products and the clinical application. And once again, I thank you to everyone who looking forward to seeing the result from this event. Okay, thank you, Corina.
Baik, mungkin terima kasih untuk Regina atas penjelasan singkat dari MedMap. Seperti yang disebutkan tadi, MedMap merupakan pihak ketiga yang mempertemukan para distributor lokal dengan manufaktur luar, terlebih dengan target utama dari Indonesia. Jadi kini kami bekerja sama dengan Turing Medical yang berasal dari China dan memiliki fokus pada deteksi dan pengobatan infeksi, vagina, serta promosi kesehatan wanita di seluruh dunia, salah satunya adalah Indonesia. Jadi, teknologi dan produk Turing ini disesuaikan dengan kebutuhan dari para pengguna, termasuk karakterisasi dan deteksi dari mikroekologi, lingkungan makro, diagnosis molekuler terkait infeksi, otomatisasi peralatan, pengembangan peralatan pengobatan anti-infeksi, dan pastinya layanan pengujian klinis pihak ketiga. Dengan headquarter dari Turing Medical sendiri adalah di Susunanu Health City. Baik, mungkin kita tidak usah berlama lagi. Sebelum kita masuk ke acara utama kita, saya izin untuk menggunakan bahasa Inggris untuk memanggil speaker pertama kita. Okay, so for the main event, I would like to invite our first speaker from Turing for presenting the clinical application for women health screening and diagnosis. So for Turing Medical, you can present right now. Thank you.
Thank you very much, Karina. And hello, everybody. And just allow me to share my screen here. All right, can I confirm with you if you can see my screen? Perfect, thank you. All right, so. Hello, everyone, and thank you to the organizers of this event for having us, and thank you all for attending. My name is Wayne Wong, and I am a representative of Turing Microbial Technologies. And today we are presenting the clinical solutions for vaginal microbiome diagnosis and treatment. So my presentation today will introduce the central aims behind our company's products and solutions, and demonstrate the key clinical value that we can offer. So with that, our presentation will today be in 4 parts. So today we will give a brief introduction into the subject of our company's focus, the vaginal microbiome. And through our solutions, we aim to address the clinical impacts of vaginal microbiome dysbiosis by bringing new technologies to update the current methods of vaginal infection diagnosis. We will conclude this part of our talk today by presenting the Turing microbial technologies enabled standardized solutions to vaginal microbiome diagnosis. Following my presentation, my colleague will present our company and products in more detail in the second half of our talk today. So let's start now with a brief introduction into the vaginal microbiome. So the vaginal microbiome is a critical part of female reproductive health. It is a unique site among all human microbiomes that comprise of a distinct microbial community that interacts and modulates the endocrine regulatory system, the local physical environment of the vaginal tract, and the local vaginal and reproductive tract immunity. The vast majority of microbes in the vaginal microbiome are long-term commensal residents. In the ideal vaginal microbiome, most associated with a healthy condition, that majority is comprised of one specific species of lactobacillus bacteria. These lactobacillus bacteria are the main functional components of the ideal healthy vaginal microbiome, determining the rest of the vaginal microbiome composition by shaping the environment through the production of metabolites such as lactic acid. A small portion of this vaginal microbiome are not persistent residents, but rather transient flora. These contain many microbes that under certain circumstances can be pathogenic and cause infections. The key function, the lactobacillus species that we previously mentioned, is keeping this transient population under control by limiting their growth and preventing infection. So overall, the vaginal microbiome is a balance of these resident commensal microbes and transient conditional pathogens that form a dynamic equilibrium. This involves interactions between microbes, host cells, and tissues in the vaginal microbiome environment. The human vaginal microbiome is quite unique among all mammals. Unlike most vaginal microbiomes of other mammals, the ideal human vaginal microbiome is low in microbial diversity, often dominated by a single species, and bears a low pH, slightly acidic, in an environment that is difficult for other bacteria and microbes to grow. Over the years, research has shown that the vaginal microbiome is most readily identifiable based on bacteria found in that microbiome. Studies has given us a 5-group categorization for the vaginal microbiome. As you can see here, the 5 groups are based mainly on the species of lactobacillus that is dominant. These groups, also called CST groups or community state type groups, reflect the vaginal microbiome community that exists. A group 1 vaginal microbiome is dominated by Lactobacillus crispatus, and group 2 by a different species, Lactobacillus gasseri, group 3 by Lactobacillus iners, and group 5 by Lactobacillus jensenii. But the one group here that differs the most is group 4. This group is not dominated by any species of Lactobacillus, but rather is low in Lactobacillus populations. Group 4 vaginal microbiomes are high in microbial diversity and is most associated with infections. Vaginal microbiome dysbiosis is a deviation from the lactobacillus-controlled homeostasis, which characterizes this group 4 of vaginal microbiomes. Vaginal microbiome dysbiosis comes in many forms. The most commonly seen dysbiotic conditions are those listed here. Bacterial vaginosis, which is an overgrowth infection by mostly anaerobic pathogenic bacteria. Aerobic vaginitis, an infection by mostly aerobic bacteria. Vulvovaginal candidiasis, an infection by fungal pathogens. And Trichomonas vaginalis, an infection by the protozoic parasite of the same name. Under these vaginal dysbiosis conditions, the vaginal tract and vaginal tissue are at high risk for additional infections from sexually transmitted diseases or STIs. Vaginal dysbiosis also causes tissue damage, genetic instability and DNA damage, increased inflammation, and also can lead to infections of other parts of the reproductive tract, including the upper reproductive tract. Due to these damaging effects, vaginal dysbiosis has become linked to many reproductive diseases and negative outcomes. Those negative reproductive health outcomes of vaginal microbiome dysbiosis have significant impacts in clinical practice. And I will briefly introduce some of these in this following section. Vaginal dysbiosis and its many forms are a very commonly encountered clinical issues around the world. Here are some basic stats regarding some of the most commonly seen vaginal infections rooted in vaginal microbiome dysbiosis. Estimates show that at any point in time, about 30% of women globally are affected by bacterial vaginosis, or BV. For vulvovaginal candidiasis, commonly known as yeast infections, this affects 75% of women worldwide at some point in their lives. The US CDC estimates that 190 million cases of Trichomonas vaginalis infection occur each year. And for most studies that have looked at aerobic vaginitis, or AV, up to 24% of women are found to be affected by this condition. These numbers impact healthcare systems and costs directly. The estimated annual global economic burden of treating symptomatic BV alone is 4.8 billion US. Further, in the US alone, the economic burden of BV is tripled when including costs of BV-associated preterm births and human immunodeficiency virus, or HIV cases. So these infections are all indicated by vaginal dysbiosis, and diagnosis of these conditions are commonly done through investigation of the patient's vaginal microbiome. To accurately diagnose these all too commonly occurring conditions, accurate vaginal microbiome identification is required. So as we have discussed previously, Lactobacillus species are the markers of a healthy vaginal microbiome. They serve to protect the reproductive tract against infectious pathogens, protects against inappropriate inflammation, and supports the reproductive immune system. This is especially important during pregnancy, when the body undergoes dramatic changes, both physically and immunologically, to allow for the growth of an embryo and fetus. Lactobacillus species produce lactic acid and antimicrobial compounds that protect against pathogens. They are the central microbes that comprise of the optimal reproductive microbiome most associated with health and healthy reproductive outcomes. The complex immune changes that are critical in the pregnancy process are affected by these reproductive tract microbiome microbes. On the flip side, depletion of lactobacillus species, a marker of vaginal microbiome dysbiosis, is actually linked to many adverse pregnancy outcomes, including upper reproductive tract infection of tissues such as the placenta and uterine microbiome. Also, first trimester miscarriages and increased risk of premature rupture of membranes, or PROM, leading to preterm birth. The evidence for a mechanistic link between lactobacillus depletion and these negative outcomes comes from a multitude of studies suggesting immunological modulation by microbes in the reproductive tract. Therefore, during pregnancy, knowledge of the state of the vaginal microbiome is critical to ensuring that the pregnancy is healthy. Another key determinant of disease that vaginal dysbiosis promotes is inflammation. Inflammation is a crucial part of the immune response, but is also the basis of many diseases. Vaginal dysbiosis utilizes this process to disrupt the host immune function and make it a causal factor in many poor reproductive outcomes. So as we've discussed earlier, one of the key functions of lactobacillus bacteria is the modulation of the inflammatory response. Lactobacillus-dominated vaginal microbiomes have been clearly shown to be anti-inflammatory and reduce the expression of the signaling molecules that lead to inflammation. Under vaginal microbiome dysbiosis, that controlling effect of lactobacillus is taken away because of the reduction in lactobacillus microbes. In disease conditions such as BV and AV, infection by pathogens are linked directly to increases in inflammation. The vaginal microbiome is also linked to the microbiomes of the upper reproductive tract, affecting the uterus and endometrium, for example. Through processes that can see infectious pathogens from a dysbiotic vaginal tract ascend into the uterine microbiome, vaginal infections are often associated with deleterious changes in the uterine microbiome, causing increases in inflammation in these areas. This inflammation leads to several disease conditions that have serious impacts to reproductive health, including endometriosis, pelvic inflammatory disease, or PID, and infertility. In this way, the vaginal microbiome is an important marker of the health of the entire reproductive tract, making monitoring of the vaginal microbiome a key indicator of female reproductive health. The vaginal microbiome is important in determining long-term health and life-changing diseases, including cancer. The negative impacts of vaginal dysbiosis causes the host tissue and cells to bear the marks of cancer development. Infection by vaginal pathogens cause clear tissue damage that can penetrate to basal tissues and immune cells, damage to DNA through reactive oxygen species, and inflammation. This kind of serious cellular and DNA damage leads to altered cellular metabolisms that run the risk of oncogene activation. To repair this tissue damage, the host tissue will also activate angiogenesis, which is the bringing of new blood vessels into the area to facilitate tissue repair. But these can also become the sources of nutrients for any developing cancers, enabling cancer growth. One of the key associations between the vaginal microbiome and cancer is HPV, or human papillomavirus. Vaginal dysbiosis has been linked to increased risk of HPV infection that leads to development of cervical cancer. This further highlights the importance of monitoring the vaginal microbiome as a risk factor in serious long-term disease. Currently, the recommended first-line antibiotic for most of the common vaginal infections are metronidazole a 5-nitroimidazole type antibiotic, and clindamycin, a macrolide. These are used either orally or applied intravaginally. These treatments have a similar efficacy and cure rates for women with vaginal infections in the short term. But despite the wide availability of these treatments, the recurrence rate of certain infections after therapy can be as high as 60% or even higher in some cases. This causes significant frustration for both patients and physicians, and can push patients to seek more healthcare services or even the use of unproven folk or home remedies that are completely ineffective as cures or even detrimental to health. The recurrence rates of BV has been reported to be higher than 60% in some studies, while recurrence rates for VVC and TB have been quoted up to 9% and 17%. This represents a huge challenge to the current state of vaginal infection treatment, as patients keep having to come back to seek treatment for the same repeating conditions that become chronic. Because of the recurrence of vaginal infections in clinic is so difficult to determine, most cases could either be reinfection or vaginal relapse, as the clinical presentation is very similar in many cases. But one of the potentially most common causes of recurrence is the failure of antibiotic therapy to cure the infection. Because of the limited options for recommended treatments, patients may be receiving treatment that is just ineffective according to what the vaginal microbiome is currently in place. Patients may also be reinfected by untreated sexual partners. And we have emphasized the importance of lactobacilli in the vaginal microbiome. And here again, we see that the reestablishment of a lactobacillus dominant microbiome is crucial to long-term cures. But antibiotic therapy, as it stands now, may not be allowing for that type of microbiome, healthy microbiome, to reestablish. We know that the host immune system changes under dysbiotic conditions. So an altered immune response may be causing a dysbiotic microbiome to reappear. Also, pathogens themselves have many ways to protect themselves against threats, such as antibiotics. A limited treatment regime may not be sufficient to remove fully persistent pathogens. All of this highlights the need for accessible diagnostics that can accurately characterize the vaginal microbiome in play in any patient. Vaginal dysbiosis and infections are a challenging part of clinical care, with currently limited treatment options. But many new treatment options are now being explored and developed. New antibiotic therapies are being considered in conjunction with new fields such as probiotics, such as live bacterial therapeutics, biofilm disruptors, and vaginal microbiome transplantation therapy. All of these treatments are aimed at preventing serious disease and improving the quality of life for patients. But a key part of this is accurate and accessible diagnostic tools that can identify and characterize a vaginal microbiome based on the microbes that are present. The Turing Microbial Technologies clinical solutions we are presenting today is designed to be that tool. Our aim is to improve prevention of serious disease by providing timely diagnosis to improve treatment of common vaginal infections, and to inform novel treatments that depend on the identification of key microbial species. All of this to improve vaginal infection therapy with accurate and accessible vaginal microbiome diagnoses. The currently available diagnostic tools for the vaginal microbiome are many, but are also subject to common issues that make them difficult to manage and to utilize correctly. This is a representation of the complex landscape of recommended vaginal microbiome diagnoses today. Multiple health authorities from around the world have put forward diagnostic guidelines to help try to navigate this complex landscape. Clinicians are constantly trying to navigate this and deal with the challenges and technical expertise requirements for many of these diagnostic tools. From the simplistic AMSL's criteria for diagnosing BV to more recent advances in molecular technologies, standardization of diagnostics for vaginal infections is difficult. Techniques can range from the tried and true methods of microscopy using wet mount or gram stain slides to visualize microbes under the microscope. Tests for vaginal metabolites have been available for decades, such as BD-Blue for testing for sialidase activity. Both long-established and newer molecular test methods are now coming to bear and becoming available, notably in offerings such as BD-Affirm or BD-Max. And culture methods have consistently been used as verification for the presence of specific species of bacteria in any sample. But for most of the common vaginal infections, authorities do agree that microbial morphology, as observed by microscopy, is usually the gold standard. Specifically, for example, with gram staining and Nugent scoring for BV. But the plethora of diagnostic options available here makes diagnosis unnecessarily complex. Individually, the current options for diagnoses have many disadvantages. For manual microscopy-based methods, the level of skill and expertise required for dependable diagnosis is high. Access to this type of skill is often difficult to acquire. Same with the equipment required for microscopic methods. These methods required skilled users to analyze slides manually, which is both time-consuming and tiring for the user, which can lead to errors. Manual microscopic examination of vaginal microbiome is also very subjective, as the user must discern morphology and staining that often can be very close in practice. This entire process of manual microscopy is also extremely difficult to standardize, as sample quality and user perspective often changes between locations and individual users. Other non-microscopy methods are often a positive-negative dichotomy readout. These tests are non-quantitative and often not useful unless in combination with other tests, as the sensitivity of these tests are often very low. Traditional culture methods are often seen as the most reliable, but these methods are very time-consuming and require the expertise and facilities to carry out. And for clinical options such as the simple AMSL criteria for diagnosing BV, this has also been shown to be highly subjective, low in sensitivity, and near impossible to truly standardize. Another factor that adds to the complexity of diagnosing vaginal infections is that more and more often, vaginal infections are observed to not occur in isolation as individual cases of BV, AV, BBC, or TV. Instead, different types of vaginal infections can often occur at the same time, making accurate diagnoses more challenging. Studies have shown that a significant portion of cases of BV occur together with VVC, and even more often with cases of TV. Studies have shown that up to 20 or 30% of all BV cases co-occur with VVC, and up to 60 or 80% of all BV cases can co-occur with TV in some studies. Under these mixed vaginitis conditions, the complexity of diagnosis requires accurate and consistent diagnostic tools to identify all relevant pathogens and fully inform treatment. Our company's clinical solutions, the Turing microbial technology product lines, aim to solve the complexity of vaginal infection diagnosis with automation, with standardization, and with consistency. Our company has deep roots in gynecological research. Our first major development came from a collaboration with Turing Award laureate Dr. Yao Qizi at the prestigious Tsinghua University, where we participated in the design and validation of an AI analysis software powered by deep neural networks, able to analyze and diagnose BV patient samples with better accuracy and consistency than the majority of human experts. We recently completed the world's largest vaginal microbiome multi-center study in collaboration with over 40 regional hospitals and world-renowned vaginal infections expert, Dr. Jacques Ravel, to identify a baseline ideal vaginal microbiome for Asian women. These efforts are all enabled by our dedicated research center located in Beijing and our collaborations with top researchers and institutions in China and abroad, allowing us to fully test and validate our products both by ourselves and by third-party experts. These efforts have translated into our major product lines, designed to approach vaginal microbiome diagnosis and therapeutics from three major directions: AI-assisted standardized solutions, molecular solutions, and products designed for daily feminine care. My colleague today will detail these product lines in full in the next portion of today's presentation. And with that, thank you for your attention. I would like to pass this along to my colleague up next as the next speaker to better introduce our company and our products in more detail to show what Turing Microbial Technologies can offer. Thank you very much.
Oke, baik. Thank you, Turing Medical, for the presentation about clinical application for women health. Mungkin untuk rangkuman singkat ya dari presentasi speaker pertama, terdapat beberapa hal yang pastinya mempengaruhi infeksi dari vaginal atau vaginal dysbiosis dan bagaimana hal tersebut mempengaruhi condition atau health dari para wanita. Disebutkan juga bahwa inflamasi adalah salah satu hal pertama yang mempengaruhi infeksi pada uterus dan sering dikaitkan dengan disease atau penyakit yang sangat berpengaruh pada fertility wanita. Oleh karena itu, untuk mencegah hal tersebut, para wanita dapat untuk mendapatkan pertolongan ketika pertama mendapatkan penyakit ini atau ketika terdapat relapse. Sehingga Turing Medical pada kesempatan ini memberikan contoh cara untuk preventing atau menghindari hal ini terjadi, salah satunya melalui treatment dan terapi. Speaker juga memberikan gambaran bagaimana diagnosa menggunakan microbial morphology lebih unggul dibandingkan cara lain seperti molekular atau culture. Oleh karena itu, mungkin setelah mengetahui clinical application untuk kesehatan wanita, sekarang saya undang speaker kedua kita untuk memberikan presentasi terhadap product solution dari Turing Medical yang mempengaruhi condition tersebut. Right now, I would like to invite our second speaker from Turing Medical to present their product solution. And for our speaker now, you can present it. Thank you.
Great. Can everybody hear me?
Yes, we can hear you.
Okay, great. Morning, everyone. I'm Ziwei Wang. I'm from the Department of Marketing in Turing Microbial Technologies. And I will give you guys a brief introduction of our product. So I'll first briefly introduce our company and then our product from diagnosis and therapeutics. So our company is founded in 2018 and we collaborate with Tsinghua University and Yao Qizi academician. He is also the only Chinese Turing Award winner. We have 4 outside. The first one is in Beijing, and our laboratory is also here. We participate in multiple research, including with the Union Medical College Hospital like my colleague just mentioned, and Jacques Ravel, professor of Maryland School of Medicine, and he's also the editor-in-chief of Microbiome, the magazine. We also have a branch in Shanghai. Our research and development department of biomaterial is there, and the Department of Consumer Goods is also there. We also have two ISO certified factories in Changsha and Suzhou. So let's see about our product. The first is the morphology test. So as my colleague just mentioned, the brain stain is actually the golden standard for a laboratory test of bacterial diagnosis. And it's recommended by United States, European WHO, and also the Chinese consensus and guidelines. So you guys might want to ask why, since this method is recommended by so many areas and so many experts, why most hospital or clinics around the world are still using the AMCEL method. That's because actually the human operation in the whole brain stain and observation steps might lead to deviation and inconsistency of the result. For example, when sampling, most hospital and clinics are still using the cotton swab, which will cause the swab will absorb the moisturize in the vaginal discharge, and because the different infections result in the different type of dental secretion. So when we try to smear it and on the slide, they will cause different, unevenly distribute on the slide. So when we try to stain the slide, the thickness part will cause the color deviation, lead to mid-judgment. So when people try to observe it, it's hard to tell which part is the cell, which part is the bacteria, and other morphology. So the other reason is that different technicians have different experiences and time of work. So they have different accuracy when they see the same slide. There are also surveys that shows the consistency of different hospital compared to the quality control expert are only 40 to 90%. So to solve the problem that caused by manual operation, we provide this full automated morphology detection platform, the Koch series. So we try to solve the problem caused by manual operations step by step. The first is sampling. Instead of the cotton swab, we try to develop a new standardized sampling swab using silica gel, which made the vaginal discharge easily eluted. And we also provide a microbe treatment and preservation solution. It will break up the clumps in some patients and ensure the sample will be evenly distributed. Also, this solution has a cap on it, so it's easier for us to transfer the sample from outpatient department to laboratory. So after we obtain our sample, the laboratory could just easily put the sample on the sample rack, and this slide prep step will be the slide prep step will be used by this Koch 60 or Koch SG10, which is a liquid-based slide prep device. It used a liquid-based thin cell layer technology. So after you put this sample inside, it will automatically process everything and fix the slides. So it can be connected to the downstream module for gram stain, or you can manually upload or unload the sample as well. So for the gram stain, we have this classic 4-step gram stain called G60. It can efficiently control the time of each step. So it will avoid the over positive or over negative caused by manual operation. And it has a better consistency compared to the human dyeing process. And separate delivery lines of each color and nozzle will avoid cross-contamination between each slice. So here is a sample of a manual smear slide and a manual stain with the liquid-based slide spread and the automatic gram stain. So we can see for the manual slides, the sample are now evenly distributed, and we can see a clear over positive, over negative area, and the cells are very thick, so we can't even see like which part is the cell, which part is the bacteria. But using the liquid base, because it will centrifuge the sample, so we can get a more evenly distributed result. So for example, we can see the T. vaginalis here is much easier to identify than the manual slide here. And also without the overlap of the cell, we can see clearly about the cell from human and other bacteria here. It makes easier for the microscope to detect different part of. Also, what I just present, the Koch series, are more for the big hospitals. But for the smaller clinics, we also have the solution. It's a semi-automatic morphology detection platform. It's called Albi Auto Scan. So the sample collection are the same, and we have a built-in liquid-based slide prep and the gram stain 2-in-1 Koch G40 device. After the slide preparation and gram stain, we need to manually take out the slides and put it into the microscope. And here we can see this is Auto Scan X1. It has a single slide capacity, which suit for the testing standards that are less than 1,000 samples per month. And then the X4, which offers about 1,000 to 1,500 slides per month. And after we put the slides into the auto scan, we have the AI assistant analysis software. So for both platforms, we have the same AI assistant microbial diagnostic software, which is the only software approved as a Class 2 medical device in China. So after we put into the microscope device, it will automatically scan, and the AI analysis were generated simultaneously. So the physician only need to review the result, and the report is generated within 2 minutes. So the artificial intelligence software were developed over 30,000 data sets provided by an expert technician, and the deep neural network learning module was jointly developed by the Tsinghua University and Professor Yao. We can see that here the AI assistant diagnosis of bacterial vaginosis has an excellent accuracy and consistency compared with the expert technician. So for the bacterial part, it will provide exact bacterial types count and cell count based on the Newton score of bacterial morphology. And for the fungal and T. vaginalis, they will mark automatically about which part the AI sees as the fungal spores or building spores and T. vaginalis. This will help the physician when he tries to reveal the result. It will make it easier to see. For the software, we also have this multi-center clinical trial and third-party tests to verify the accuracy and consistency of it. So we contact Tsinghua Chang'eng Hospital, Changsha Hospital in Changsha, and Peking Union Medical College to test the result. And the study was double-blinded, and we tested over 100,000 patient samples. As you can see, that the result shows the specificity and sensitivity of detecting bacterial diagnosis. Albert vaginatus and VAC is over 90%. And for the T. vaginalis, because it's a little bit larger and easier to see, the accuracy is basically 100%. So, except our morphology test, we also provide a molecular test for more specific bacterial detection. So some common virginal bacteria still similar in morphology and difficult to distinguish for some technicians. For example, you can see the lactobacillus, and other two are the bacterial vaginosis related bacteria, which is Atopobium and Gardnerella. Those are similar under the macroscope because of their rope shape. And also under the current diagnosed criteria, which is Asmal and Nugent, we can only make sure what we see this is a certain category of infection. But for the drug resistancy and the different pathogens are still like difficult to distinguish, because this is different from what patient has, like the previous infection, and even some drugs they use or cause different drug resistancy, make it hard to treat and easy to relapse. Also, with the development of bioinformatics technology, we have actually more understanding of bacterial vaginosis. We can see that there are over 10 subtypes of bacterial vaginosis under the current criteria. So Professor Jeffers-Malvo, he also thinks that the current clinical standard are established more than 30 years, and the ASMO is actually developed in 1982. So it's a 40 years ago, so like diagnostic criteria, and it can't explain what we find right now, and it can't provide a like in detail treatment method. That's why we conduct this the world's largest multi-center study on microorganisms, as my colleague previously mentioned. And based on the results of this study, we developed the bacterial GTI molecular test. And the baseline data is set by the study I just mentioned. And this test will provide a real virginal microbiota status and reflect the real composition of probiotics and pathogenic bacteria. So for this heist, we have 6 probiotic biomarkers, 14 bacterial vaginosis biomarkers, and 5 aerobic bacterial vaginitis biomarkers. And the result will come out within 40 minutes and basically need 0 manual operation. And here's the preliminary morphology screening here with the Newton score, the donut score, and the evaluation of T. vaginalis and VVC. And here is the result of the molecular test. It will determine the pathogenic microorganism and establish a precise treatment plan based on what we find. So it have a community state tab and comprehensive disease evaluation here. So except for the bacterial genital tract infection kit, we also provide the sexual transmitted disease and group B streptococcus kit. So one is for the special test if patients need, and the other is mainly for the pregnancy management. And our product also contains therapeutics. So we can see that the extragenic pathogenic microorganisms are normally come from the outside of the genital tract, but causes, like, it's an important factor for reoccurrence of the genital tract infection. So daily cleaning of the vulva helps cut off the reproductive tract infection by eliminate EPM. That's why the Middle East and Central Asia guidelines and the Royal College of Obstetricians and Gynecologists all recommended that using a mild hypoallergenic fluid with acidic pH to wash the vulva daily will enhance the skin homeostasis. That's why we developed this bacterialistic wash with main ingredient of lactic acid. So we can see of the result here. While this wash have an excellent efficiency of antibacterial effect on common pathogenic bacteria, it preserves the lactobacillus, which is the probiotics. So last, we have the everyday products CDMO, and we have more than 4,000 square meters GMP factories with ISO certification. So all of our products are self-developed and self-assembled. Thank you. That's basically all.
Okay, thank you for the presentation, Ms. Alice. Maybe before the Q&A session, I would like to make a summary from your presentation. Jadi dari sesi speaker kedua ini dapat diketahui bahwa Turing Medical sebagai salah satu manufaktur menciptakan beberapa produk untuk deteksi bakteria seperti melalui morphology detection yang mencakup staining device, AB autoscan, serta slide scanner. Serta melalui produk molecular detection, melalui AV or BV molecular test, STI and GBS detection kit, serta IVD products. Dan yang terakhir, Turing juga menciptakan therapeutics atau terapi untuk permasalahan ini. Produk yang dihasilkan oleh Turing tentunya digunakan untuk menunjang scanning dan diagnosis terhadap kesehatan wanita, terlebih melalui pencegahan inflamasi dan relapse pada pasien vaginal diabetes. Baik, setelah ini untuk para audiens dalam Zoom dapat memberikan pertanyaan langsung kepada speaker kita jika memiliki pertanyaan terhadap presentasi yang dilakukan atau atas clinical dan produk yang disampaikan. Mungkin pada kesempatan kali ini saya himbau partisipan untuk dapat open mic dan kamera ketika memberikan pertanyaan serta untuk menanyakan dalam bahasa Inggris. Namun jika terdapat kendala, saya dapat membantu Bapak dan Ibu dalam kesempatan kali ini. Baik, mungkin Bapak dan Ibu saya buka Q&A session dan dipersilahkan untuk memberikan pertanyaan. I will open Q&A session now, so please open your mic and video if you have any question for our speaker, or you could direct message me through chat so I can read it out for you. Thank you. Any questions? Okay, for Regina, you could ask your questions.
Okay, so I think the participant also wondering about how much is the cost estimation about the products, especially the coach series. Okay. That's it.
Okay, for the speakers, you can answer it.
Okay. Okay. Actually, we have the different because in China we have the big hospital, like we use the cohort series. The prices are nearly about like 30,000 RMB. 300,000 RMB. It's about like 50,000 US dollar. That's for the cohort series. For the like the semi-automatic series, like the X1 and X4, and plus the SG 10, the price is nearly about like 100,000 RMB. It's about like about 20,000 US dollar. And actually, based on the test quantity, usually if you a hospital can use a lot of the consumables and because actually for one hospital, if we have like 20,000 tests per month, we can usually we can give the semi-automatic products for free. And for the hospital, if you can consume the test like about 4,000 and 5,000 per month, and we can maybe we can discuss for the give the cohort series for free. Usually for the one single test, we give the distributor for the price is like about 20 RMB. It's about $3 US. And in China, the test, the final product for the final price for a consumer is about like 100 to 200 RMB. It's about like about $30 US. For patients, yes.
Okay, I got the point about the answer. Thank you.
Okay, thank you, Regina. Maybe there's another question for the participant if they would like ask the speaker. You can open your mic and video. Is there's anyone who still got question for our speaker? Anyone?
Hi, Karina. Just to say that if anybody does have questions that they may think of later on, I do have my email available as well on my presentation. If you are, if feel free to share that with any anyone who would have questions later on, so that they may communicate with us directly.
Okay, that's cool. Maybe you can send your email to chat right now too, so everyone
Yes.
can saw the message. Baik, jadi di kolom chat sudah ada email dari our manufacturer. Jika masih ada pertanyaan, silakan untuk email di wang.y@tmicrobio.com. Mungkin jika tidak bisa email, bisa juga melalui CP saya yang sudah saya share sebelumnya ke para distributor. Baik, mungkin ada 2 email yang bisa di-save untuk para distributor jika masih ada pertanyaan. Mungkin sekian dari kami, saya akan tutup. Okay, so thank you for your participation. So if there's no question, I would like to close this session today. Baik, jadi kita sudah sampai di penghujung acara pada hari ini. Sebelumnya terima kasih atas partisipasi Bapak dan Ibu yang telah meluangkan waktu untuk join pada Events Women Health Screening and Diagnosis. Mungkin seperti yang disebutkan di awal, untuk informasi di bulan depan kami juga akan mengadakan webinar seperti ini, mungkin dengan tema yang berbeda tentunya. Dan pastinya kami akan mengundang speaker-speaker yang pasti tidak kalah keren dari speaker kita pada hari ini. Mungkin jika ada pertanyaan lebih lanjut mengenai event hari ini tentang speaker atau event kami selanjutnya, Bapak dan Ibu dapat untuk melakukan direct message ke nomor yang akan saya berikan setelah ini melalui kolom chat atau melalui CP yang telah saya sebarkan sebelumnya. Mungkin sekali lagi terima kasih atas partisipasi Bapak dan Ibu pada hari ini. Saya mohon maaf mungkin jika ada salah kata dari awal hingga akhir, dan semoga dapat bertemu Bapak dan Ibu di lain waktu. Mungkin saya Corina dan segenap tim MedMap maupun Touring Medical undur diri dan terima kasih dan sampai jumpa. So thank you for your participation today. May we see each other in another chance. See you. Thank you.
Thank you.
Thank you very
Bye.
much.
Thank you.
Yeah.